My name is Juliane Walz. I'm a professor at the University Hospital Tübingen, and I would like to introduce you today to the FusionVac 2202 trial. This trial was enabled by the generous funding of the FCF and will help to develop novel therapies for fibrolaminar cancer patients. FLC is a rare liver cancer that usually affects children and young adults without any underlying liver disease. So far, beyond surgical resection, there is no approved therapy for this disease. So in particular for patients diagnosed with advanced or metastatic disease, we have no current therapies. So there's a really urgent need to develop novel treatment approaches. FLC is driven by a specific genetic alteration, a so-called gene fusion, where two genes get together, and this gene fusion was shown by our group to give rise to short protein fragments on the cell surface of cancer cells, so-called peptides, that are presented to the immune system. We now have the possibility to produce these peptides synthetically and develop a therapeutic vaccine with the idea to train the immune system to detect the specific gene fusion and to destroy FLC cancer cells. We have applied this specific cancer vaccine already to cancer patients suffering from FLC and have seen that it's safe and could induce very strong immune responses driven by T cells, which are the most powerful cells of the immune system to fight against cancer. Further, we could show in 2 young patients with FLC that achieved or received this vaccine that they could achieve long-term remission and cancer-free survival. Based on this, we have established back in 2023 the first clinical trial evaluating this therapeutic vaccine in FLC patients with advanced and metastatic disease in combination with so-called immune checkpoint inhibitors, which are specific immunotherapies that activate the immune system in general. This trial is successfully recruiting and has proven safety, immunogenicity, and first efficacy. Based on the promising data of our first trial, we now established, supported by the FCF, a second trial that will evaluate our peptide vaccine as a single agent in FLC patients in the adjuvant setting of disease. Adjuvant setting means patients that have achieved a remission of their tumor by, for example, surgery, radiation, chemotherapy or any other drug treatment and have at the moment no tumor disease measurable. However, we know that these patients have a high risk of relapse, and for these patients we now offer our second vaccine trial to prevent relapse in these patients. The trial will recruit 20 patients at the University Hospital Tübingen, which is located in the south of Germany. The patient will receive 2 doses of the vaccine within a 4-week interval. Afterwards, we will check if the immune system responds to the vaccine. And if this is not sufficient, we will apply a booster vaccine. Afterwards, the patients are followed for safety, immunogenicity, and efficacy up to 6 months. For further information, please check our landing page that will give you further information on the study procedure as well as on the criteria for patients to participate in this trial.